Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering pharmacology, and to be more specific, I'm going to be covering reproductive issues. Now guys, if you haven't done so already, please do not forget to like and subscribe below. That's how you can support this channel. If you're a current student, you need some additional help, guys, make sure you check out my website. I have audio lessons available. I have coffee tumblers. Here we go. Coffee tumblers with tips on which patients are your priority patients, tips on important test subjects that you're going to know when you're studying. And I also, what do I have on my Tumblr? Oh yes, also blood compatibility. Also, very soon I'm going to be selling my study guides, and they're going to be study guides per subject. So if you have an exam coming up and you need the most important things you need to know, because yes, you are going to see it on your exam, they're coming up soon. So watch out for that. Of course, guys, don't forget about my podcast. Look me up, Nexus Nursing. I'm on every major streaming platform. So guys, without further ado, let's get started. First question. Which of the following is a priority for the nurse to include in the instructions for a client starting estrogen hormone replacement therapy for menopause? 1, report an increase in weight of 3 pounds or more to your doctor. 2, take extra safety precautions to protect yourself from injury and falls. 3, you may have greater frequency and urgency in urination. Or 4, remember to do a self-breast examination every month. And guys, the correct answer is 4. Remember to do a breast self-examination every month. So these patients that are taking estrogen hormone replacement, if they're menopausal and they're taking that estrogen hormone replacement, that places them at a higher risk for breast cancer. So it's very important to teach the patient to check their breasts every month, and you're going to teach them to choose a day, an important day, so they don't forget, whether it's the first of the month or, you know, the day that they're due to pay their mortgage. Because remember, you can't tell them, you know, to choose it on a day, you know, when you get your menses, because they're menopausal. They don't have their menses anymore. So you're going to tell them to choose an important day and to make sure that they're checking that every month. Now, let's look at the wrong answer choices. 1, report an increase in weight of 3 pounds or more to your doctor. Patients who are taking estrogen replacement hormone, that's a side effect of the medication. We don't want them to gain too much weight, but that's not going to be a priority like the breast self-exam is going to be. So that's not the answer. 2, take extra safety precautions to protect yourself against injury and falls. We would be teaching that to the patient who's postmenopausal and not taking any estrogen replacement, because remember, guys, estrogen is what helps keep that calcium in the bone. So when the patient goes through menopause and they're no longer producing as much estrogen, that is allowing that calcium to leave the bones, and the patient's at risk for what? Osteoporosis. So that's when we would teach the patient about number 2, when they're at risk for osteoporosis, which means their estrogen is low, they're not taking their replacement. Not so much for the patient that's actually taking the replacement. 3, you may have greater frequency and urgency in urination. That actually, again, just like the weight gain, number 3, having greater frequency and urgency in urination, that also is a side effect of the estrogen replacement therapy. We're going to be watching out for that. We're going to teach the patient to watch out for that, but that is not going to be a priority such as the self-breast exam. Guys, whenever you guys get a question about priority, you need to think to yourself, which one will kill the patient? Which one is most dangerous? Okay? Which one will put my patient's physiological integrity at risk? Next question. After receiving instructions from the nurse regarding the drug, you guys know I cannot pronounce, alendronate, it's Fosamax, which of the following statements from a postmenopausal client indicates an understanding of the purpose of the drug? 1, the drug should help my mood swings. 2, the drug should eliminate my stress incontinence. 3, the drug should make my bones stronger. 4, the drug should relieve my hot flashes. And guys, the correct answer is 3. This drug should make my bones stronger. Why? This drug's a biophosphate, and that's exactly what it does. It makes your bones stronger. And so you're going to teach the patient that they should take this medication in the morning before they have anything to eat, with a full glass of water, and they need to be sitting up for a good solid 45 minutes to an hour after they take this medication, because it's very, very harsh on the esophagus and it may cause some erosion or ulcers. The nurse instructs a perimenopausal client that it is a priority to stop taking the prescribed estrogen if which of the following occurs: 1, spotting between menstrual periods; 2, painful intercourse; 3, breast tenderness; or 4, nausea and vomiting. And guys, the correct answer is 4, nausea and vomiting. Well, why nausea and vomiting? Professor D, when it comes to pharmacology, everything causes nausea and vomiting. So why would we be so concerned about nausea and vomiting when it comes to estrogen replacement in this type of patient? Here's why. Go back to the question, and it doesn't say that the patient is menopausal. It doesn't say that the patient's postmenopausal. What does it say? It says perimenopausal. So they're kind of in that in-between phase. They're going towards menopause, not having their menses anymore, but they're not there yet, which means what? They're still fertile. They can still get pregnant. So if this patient starts getting nausea and vomiting, we want to make sure that they are not pregnant. Why? Because pregnancy is a contraindication to taking this drug. You cannot be taking estrogen replacement hormones if you are pregnant. Okay, so that is what we were concerned about. Now let's go over the wrong answer choices. 1, spotting between menstrual periods. Those are side effects of that of the estrogen. 2, painful intercourse. The patient will have painful intercourse because of vaginal dryness. And what happens is the older woman will have vaginal dryness as she goes towards menopause. As her estrogen decreases, she'll experience that vaginal dryness. Choice 3, breast tenderness. Also, that is a side effect of the estrogen therapy. So choices 1 and 3, those are side effects of the estrogen therapy. And choice 2 is something that happens when you don't have enough estrogen, which means that person's not getting enough estrogen therapy or they're not taking any at all. But for this question, what they're asking about is what condition would cause a patient to completely stop taking this medication? And it would be any signs and symptoms of pregnancy, because being pregnant and taking this medication is completely contraindicated. Based on an understanding of drugs, the nurse plans to instruct the client with amenorrhea to use which of the following drugs? 1, danazol; 2, progesterone; 3, estrogen; or 4, naproxen. And guys, the correct answer is 3, estrogen. Go back to the question. Look at what they're asking us. They're asking us which one will cause amenorrhea. Okay? Now, the reason estrogen is the correct answer, guys, which one? Guys, let me go back to the question. I'm sorry. Based on the understanding, instruct the client. Sorry. Forgive me, guys. I'm going to reread that. Based on an understanding of the drug, the nurse plans to instruct the client with amenorrhea to use which following drugs. So the patient has amenorrhea. They're not having any menstrual cycle. So which one are they going to be instructed to take? Well, obviously, if they're not having a menstrual cycle and they're going to be instructed to take something, it would be something to help them have a menstrual cycle, right? Okay, so it would be estrogen. Why? Because estrogen stimulates ovulation. Now, let's look at these wrong answer choices. We have 1, danazol. Danazol, guys, actually does the opposite. It suppresses ovulation. Choice 2, progesterone. Guys, progesterone, that's the one that causes you to shed that uterine lining. And so what is the shedding of the uterine lining? That's the menstrual cycle. Choice 4, naproxen. You guys know what naproxen is. Naproxen is an NSAID used for many conditions, one of which is dysmenorrhea. Okay, but for the patient with amenorrhea, if they're going to be given something to try to get them to get their menstrual cycle back, it's going to be estrogen. Think about it, guys. If a patient has gone through menopause or they're postmenopausal, they don't have their menses anymore. Why? What is lacking that they're not having their menses anymore? Estrogen. So if we want a patient to get their menses, what are they going to get? Estrogen. It makes sense, guys. Okay, next question. Which of the following should the nurse include in the instructions to a client receiving an NSAID? 1, do not take the drug with lithium. 2, avoid the use of products with caffeine. 3, notify your physician if you become pregnant. Or 4, take on an empty stomach. And the only correct answer, guys, is number 1. Do not take with lithium. Why? Guys, NSAIDs can cause lithium toxicity. So if a patient is taking lithium, can they take NSAIDs? No. Okay. Let me not say no, because in some situations they can, but if they do, you're checking what? The patient's lithium levels very, very, very closely. Now let's look at the wrong answer choices. Choice 2, avoid the use of products with caffeine. That's not contraindicated. You could drink caffeine when you're taking NSAIDs. Choice 3, notify your doctor if you become pregnant. That's not contraindicated. You can take NSAIDs when you're pregnant. Choice 4, take on an empty stomach. Do we ever teach patients to take NSAIDs on an empty stomach? Absolutely not. Why? Because we know one of the things NSAIDs can do is cause gastric irritation. Patient can develop an ulcer. That ulcer can bleed. So we never tell patients to take NSAIDs on an empty stomach. We tell them to take it with food because we don't want them to develop ulcers. Okay? So that's why number 1 is the correct answer. Which of the following allergies should the nurse assess for a client who's taking naproxen for the treatment of dysmenorrhea? 1, morphine, 2, penicillin, 3, aspirin, or 4, Tylenol? And guys, the correct answer is 3, aspirin. Why? I want you to think about it. This is where your critical thinking comes in, guys. The patient is allergic to naproxen, and we know naproxen is an NSAID. So aren't we going to be concerned if they're also taking aspirin? What is aspirin? It's an NSAID. Usually if a patient's allergic to one NSAID, they're allergic to the whole family of NSAIDs, okay? So that's why number 3 is the correct answer. Now let's look at our wrong answer choices. 1, morphine. Morphine's a narcotic. We're not going to be concerned. If the patient's allergic to an NSAID, we're not going to be too much concerned about the narcotic. 2, penicillin. That's an antibiotic. And 4, Tylenol. Tylenol is a non-narcotic analgesic. So if a patient's allergic to an NSAID such as naproxen, we're going to be concerned if they're taking another NSAID, because like I said, the chances are high that they're going to be allergic to that other medication that's in the same family of what? NSAIDs. Which of the following assessment findings is expected in a client with you guys know I cannot speak, premenstrual syndrome, PMS, who's receiving danazol? 1, breast tenderness, 2, hirsutism, 3, increased libido, or 4, amenorrhea? And you guys should all get this question correct, because I've already told you what danazol is. I told you what it does. So what is the correct answer? 4, amenorrhea. Why? It suppresses ovulation. You guys, by the way, you guys need to know these drugs. Okay? It suppresses ovulation. The nurse instructs a client taking Premarin that which of the following adverse reactions may occur? Select all that applies. 1, oh, by the way, guys, if you're new to my channel and you've never done select all that applies with me before, this is the rule of thumb. When you're doing select all that applies, you have to treat them as true or false. Go through each one individually. If it's true, it answers the question. If it's false, no, you keep it moving, okay? But don't try to group them together. That's how you guys get these test questions wrong. You have to go one by one, true or false. So we're talking about Premarin. By the way, Premarin is what? Estrogen, okay? So we're talking about estrogen, and they're asking for adverse effects. Many books, textbooks will use adverse effects and side effects interchangeably. There is a difference, but many books will use them interchangeably. The books I'm teaching out today, they're actually using them interchangeably. I'll explain, I might as well explain now. Side effect, guys, is something that may happen to the patient if they take the drug. The doctor really isn't going to stop the medication, but you want to warn the patient and tell them, you know, if it becomes unbearable, let us know. That's a side effect. An adverse effect is something that can happen to the patient. And if it happens, we absolutely don't want it to happen. We tell them to let us know right away, because if it happens, we're either going to stop that medication or may add another medication, or we're going to have to do some type of intervention for that patient. So there really is a difference, but very often you'll see them used interchangeably. This one's going to be used interchangeably. So I'm just letting you know. So we're talking about the medication estrogen. What adverse reaction or side effects would we teach them may occur? 1, increase in weight. True. Matter of fact, the first question that we did, I explained to you how an increase of weight is an expected side effect of estrogen therapy. You're going to warn the patient about it. We're going to keep a track on it. We don't want the patient gaining too much weight, but it is something that happens. It's a side effect. You're going to warn the patient about it. 2, heartburn. False. What kind of drugs would you see heartburn more in? NSAIDs. We just talked about it, right? Choice 3, bitter taste. False. Patients' side effect of bitter taste, we don't see that in estrogen therapy. We see that more in antifungal therapy. I'm going to be doing a pharmacology video for you guys very soon on antifungals, so you'll learn all about that. But bitter taste, no. Antifungals, not for estrogen. 4, breast pain. True. Yeah, that's a side effect. Here's what happened, guys. The estrogen that the patient take, it increases the patient's milk ducts, okay? And so, breast ducts, excuse me. Those breast ducts, it enlarges it, and that's painful often it's painful to the patient. So yes, they may experience breast pain. 5, leg pain. True. Patients will have the estrogen receptors all over their body, and if those hormones are fluctuating, the patient often may experience leg pain, so you'll want to warn them about it. 6, diarrhea. False. Even though we see, I'll talk about that in the next video, but for diarrhea, that is false. We don't really see that in estrogen, but something you may see diarrhea a lot in is antibiotics. If a patient's getting too much antibiotics, right? Diarrhea. So when it comes to estrogen, it's going to be number 1, increased weight, number 4, breast pain, and number 5, leg pain. Which of the following should the nurse include in the teaching plan for a client who has a recurrent gonorrheal infection and is treated with Cipro? 1, the drug should be taken with meals or with a glass of milk. 2, weekly cultures are necessary until 2 are negative. 3, the drug should not be discontinued until all the pills have been taken. Or 4, the drug will be started when the diagnostic culture and sensitivity results are obtained. And the correct answer is 2. Weekly cultures are necessary until 2 cultures are negative. And what's so crazy, guys, you'll see this on your NCLEX RN, but if you're going on to be a nurse practitioner, this actually is a question for FNP as well, whether you're doing C or BC. It's on both. So number 2 is the correct answer. Let's look at the wrong answer choices. 1, the drug should be taken with meals or with a glass of milk. Absolutely not. Cipro is an antibiotics, guys. Antibiotic, and it needs to be taken on an empty stomach. So that's false. Choice 2, the drug should be discontinued until all the pills have been taken. What all the pills? This patient's being treated with gonorrhea. They get 1 single dose of Cipro, just 1. So that's false. Choice 4, the drug will be started when the diagnostic culture and sensitivity results are obtained. That is false. That is absolutely false. So what happens, guys, you're going to collect the specimen, and as soon as that specimen's collected, the patient's going to take their medication. We are not going to wait until the culture results come back, because when it comes to gonorrhea, those signs and symptoms are going to be enough. You see it, you know they have diarrhea. You know they have gonorrhea. You know they've got that yellow or green discharge. They have the patient obviously is sexually active. They're having pain down there, and so you already suspect that it's gonorrhea. You're gonna go ahead and get your specimen. As soon as you get your specimen, the patient can take that medication. Remember, the cultures take a couple days because cultures have to do what? Grow, right? They have to grow. So we're not going to wait until those cultures come back for that patient to be treated. As soon as we collect the culture, the patient's going to take that single dose, and we are going to get not 1, but what? 2. We're going to get 2 results before it's 2 negative results before that patient's actually negative for gonorrhea. Which of the following should the nurse include in the medication instructions for a client with gonorrhea who's prescribed tetracycline hydrochloride? 1, continue taking birth control pills. 2, take 2 or 3 times during the day as prescribed. 3, take the first dose after the results of the culture and sensitivity are determined. Or 4, use sun protection and cover your body if going outdoors. And guys, I already explained to you why number 3 is not number 3. I already talked to you about that. We don't wait for the results to come before that patient takes that one single dose, right, of medication. So we know, oh, excuse me, what med are we talking about? Sorry, we're talking about tetracycline, which is another antibiotic. But still, we are not going to wait until those results come back. As soon as we collect the specimen, that patient gets their antibiotic. So we know it's not number 3. So we're down to number 1, number 2, or number 4. And the correct answer is number 4. Tetracycline, along with many other antibiotics, causes photosensitivity. So you're going to teach the patient to protect themselves when they're out in the sun, to wear long sleeve shirts, long pants, large brimmed hat, sunglasses. Matter of fact, on NCLEX, the question on NCLEX goes something like, you know, the patient, I forget the condition the patient has, but this is the medication, they're on tetracycline. Oh, and in the question, they tell you that the patient is a track star. They tell you the patient's a track star and the patient's taking tetracycline for whatever. And what are you going to teach a patient? And so the answer is you're going to teach a patient to protect themselves when they're outdoors, because if they're a track star, they're running where? Outside, where the sun is. Okay, very important medication. You absolutely do need to know this medication, guys. So let's look at the wrong answer choices. Number 1, continue taking birth control pills. This concept actually is also on NCLEX when it comes to the medication. If you're taking pharmacology right now, I promise you need to know this. Let me tell you something. If a patient's taking tetracycline and they are not using a barrier such as a condom, they will mess around and get pregnant. Why? Because that medication, tetracycline, it decreases the effectiveness of oral contraceptives. Yeah. She'll mess around and get pregnant. So you have to teach a patient, if you're on oral contraceptives for the time that you're taking this antibiotic, you need to use a barrier method. Otherwise, chances are you may get pregnant. So number 1's wrong. Did I go over the choices? Number 1, number 2, take 2 or 3 times during the day as prescribed. No, this medication needs to be taken around the clock. Why? Because we need to maintain the same, I cannot speak today. I'm so sorry, guys. We need to maintain the same level of this drug in the blood. So that's incorrect. So that's why number 4 is the correct answer. Excuse me. I'm going to stop for a moment. I'm going to talk. I never do this, but I'm going to talk to you guys for a moment because I know why I'm so flustered. I'm exhausted, and I'm going to tell you why. If you guys been following me for any amount of time, you know that I specialize in pediatrics, okay? I see pediatric patients, and I have 9 kids that are in the hospital right now, and 5 are in the ICU. COVID. You know how young people are. If you guys have taken, if you've taken peds yet, you understand that adolescents don't tend to think things all the way through. That part of the brain that can think long term and think about all the consequences of their actions is not fully developed. Also, you'll understand that adolescents, they always think, not me. Okay, it can happen to somebody else, but they seem to think they're invincible. It won't happen to them. Also, you'll understand that with adolescents, what's most important to them in that age group is socialization, is their friends, because that's how they start learning about self-identity and who they are, right? South Florida. We just had a huge concert apparently in Miami. I'm not going to say the name of it because I want these people to come back and sue me. But there's a huge concert. I don't know how the city even was okay with this, but whatever. And young people from all over the country came to Miami to this 3-day festival. And now 9 of my patients with COVID are in the hospital. And there's not enough staff. We're working overtime. And I still got to find time to make videos for you. And guys, I'm not blaming you because I love you. I love doing this. but I just kind of want to let you know why. If I look like I'm crazy on this video, that's why. I'm running on fumes here. So I'm sorry. All right, enough of that. Let's keep going. What number was I on? Where am I? Okay, next question. The nurse should notify the physician if which of the following occurs when treating a client receiving antibiotics for gonorrhea. 1, perineal lesions fail to clear in 2 to 3 days. 2, sexual intercourse is painful. 3, a black furry growth appears on the tongue. Or 4, spotting occurs between periods. And guys, the correct answer is 3, a furry growth appears on the tongue. Now, this patient's taking antibiotics. So when we see a furry growth on the tongue, for a patient that's taking antibiotics for gonorrhea, what is the first thing you suspect? Superinfection. That's what we're suspecting, the patient's having a superinfection. You're going to notify the doctor immediately. Now let's look at our other answer choices. 1, perineal lesions fail to clear in 2 to 3 days. That's more herpes simplex 2. Remember, 1 is mouth, 2 is down there below the belt. 2, sexual intercourse is painful. That's a part of that disease, gonorrhea. Patient's going to have painful intercourse. It has nothing to do with the antibiotics that they're taking. Choice 4, spotting occurs between periods. That also is a part of gonorrhea. That has nothing to do with the antibiotics that are being taken for gonorrhea. So guys, the correct answer is choice number 3. You need to suspect the patient's having a superinfection and reach out to the physician immediately. The nurse is creating a medication schedule for erythromycin prescribed for a client with pelvic inflammatory disease. Which of the following times for administration should the nurse include in the schedule? Administer with 1, a full glass of water between meals. 2, fruit juice prior to each meal. 3, antacid 30 minutes before each meal. Or 4, a glass of milk at each meal. And guys, the correct answer is 1, a full glass of water between meals. So erythromycin, again, guys, that's another type of what? Antibiotic. And you're going to teach the patient to take that medication 1 hour before meals. So if they're before they plan to eat, take an hour before meals, or 2 hours after meals. So that's why number 1 is the correct answer. 2, 3, and 4, absolutely wrong. The nurse instructs the client who has trichomoniasis to avoid which of the following while taking Flagyl? 1, lithium. 2, alcohol. 3, caffeine. Or 4, diazepam. By the way, this is another big NCLEX concept. They love asking about this, so you guys better know it. All right, guys, the correct answer is 2, alcohol. Now, even if you didn't know why this was the answer, you still should have chosen alcohol, just because you know patients are never supposed to take alcohol with meds. Like, duh, right? But let me tell you why. Let me give you the rationale. If a patient is taking Flagyl and they take alcohol, what they're going to get is I'm sorry, I'm having a brain fart. Give me a second, guys. A disulfiram-like reaction. Remember disulfiram antabuse? That's the medication of patients are alcoholic, and then they touch anything with alcohol, they get severely ill. Like, I'm talking about severe nausea and severe vomiting. Yeah, there you go. If a patient is taking Flagyl and then they drink alcohol, that same severe nausea and vomiting the patient would have gotten if they took disulfiram, they're going to have that same reaction. Okay, so that's very important to tell the patient while you are taking this medication, you need to stay away from alcohol or you will regret it. Which of the following laboratory tests would be most important for the nurse to monitor in a client with herpes type 2 who's taking acyclovir? 1, alkaline phosphatase. 2, WBC. 3, prothrombin time. Or 4, serum creatinine. And guys, the correct answer is 4, serum creatinine. So acyclovir, that vir is for virus, right? So when you see that VIR at the end, virus. So this is an antiviral medication. And what happens is it has the potential to be nephrotoxic. So while the patient is taking this medication, you need to be looking at that creatinine, the BUN, the urine output, because it has the potential to really harm or do damage to the kidneys. And that's why number 4 is the correct answer. Okay, guys, we are down to our last question. The nurse instructs the client with a history of... Is that the same one? No. The nurse instructs the client with a history of herpes type 2 to take the prescribed acyclovir, 1, for up to a year whenever the lesions return, 2, at the first sign of clinical manifestations returning, 3, over-the-counter ointments fail to control itching, or 4, daily for 2 weeks to prevent reinfection. Excuse me. And guys, the correct answer is 2, at the first sign of clinical manifestation returning. Remember, guys, herpes type 1, type 2, both of these are viral infections. So what happens is there's no cure, okay? It doesn't go away. It'll go dormant in your body until something triggers it, such as stress, extreme heat or cold, whatever. Something will trigger it, and then, you'll see the manifestations again. And so what happens when the patient takes a acyclovir or another antiviral medication, it doesn't cure the disease. It just decreases the duration of the manifestation, and it blunts those side effects. So for example, the pain the patient have, the pain will decrease. And those lesions, as large as they are, they'll start to shrink in size. And let's say the patient would have had the lesions for a whole week, the earlier that the patient uses that medication, the shorter the duration. So let's say it would have been for a whole week, because they took that medication, it only lasted 3 days. Okay, but let's be very clear. This antiviral medication is not a cure. It treats the signs and symptoms. It decreases the duration. It blunts the effects, but it does not cure, because it's what? A viral that we're dealing with. Guys, I hope that you found this video to be helpful. If you would like to see a part 2 of medications in regards to the reproductive system, please let me know, because there are a lot more meds in the reproductive system, as you know. So, this is just the tip of the iceberg. But if you'd like to see more, please go ahead, drop a comment below so I can add it to my list of videos to come your way. As always, guys, please don't forget to follow me on my other social media platforms. I am on Instagram, Nexus Nursing. I'm on TikTok, Nexus Nursing. I'm on Facebook, Nexus Nursing. Check out my website, nexusnursinginstitute.com. I have audio lessons available. I have my coffee tumbler available on my website, and very soon I'm going to be having test study guides available for you on my website. Am I missing anything? Oh, my dear podcast listeners, I know I have been neglecting you. I see the emails, I see them. I'm going to get to it soon. It's just 24 hours in a day, and it's just so much, but I promise I'm going to get back to you guys soon. I promise. Guys, don't forget, please like and subscribe below. I'm going to go get me some sleep. Have a wonderful day, guys. See you on the next video.